Malaria Alliance, which gives us the chance to meet with 49 heads of African countries twice a year and becomes a one-stop shop. The Asia-Pacific region was so impressed by that they decided to set up their emulation of the African Leaders Malaria Alliance. And so they've set up the Asia-Pacific Leaders Malaria Alliance. Now with the African Leaders Malaria Alliance, it was easy to call that ALMA. Now we're trying to figure out how to say APOMA for the Asia-Pacific region. And it was announced this morning in Australia that Prime Minister Julia Gillard has agreed to co-chair this new organization. So we have a lot of work to do over the next 981 days, and we've tied together malaria with the other Health Millennium Development Goals. And as you heard, the Secretary General has asked me to oversee the business plan for financing those goals. Child mortality reduced by 2/3, maternal mortality reduced by 3/4, HIV/AIDS, ending the transmission of mother to child of HIV, and providing treatment for everyone. And so we're hard at work with this expanded role, but everywhere we turn in child mortality, maternal mortality, we recognize what a big cause factor malaria is. In most countries, it represents 25% of under 5 deaths. So if we accomplish our first goal on malaria, it makes the other goals easier. Thank you very much.
Thanks, Mr. Chambers. Please, Ms. PHUMAPHI.
Thank you very much. I appreciate this opportunity to come and share with you on this important day when we commemorate the impact of this really great economic threat on the African continent, and also celebrate the successes that we have had in combating malaria on the African continent. Like the UN Special Envoy on Malaria and Health Financing has just said, ALMA comprises 49 heads of state and government, and the heads of state and government come together twice a year to assess progress that they are making, and also to appreciate the challenges that face them and find solutions to resolving some of these challenges. The mechanism that they use in order to assess this progress and to identify the challenges and the actions that need to be taken is an accountability framework that is focused on a scorecard for accountability and action. This is what the scorecard looks like. Now, what the scorecard does is that it assesses progress on policy areas, high-level policy areas that heads of state can take action on, and that they can work or support their ministers of health to take action on, or work with partners to take action on. It focuses on financial control, on financing of commodities, on implementation, and also on the impact that the fight against malaria is having on the continent, in order to actually measure the results and the progress. And the success that we have had with this mechanism and with the commitment of these African heads of state has really turned this approach, we believe, into a model for engagement in development. A successful model which focuses on accountability, on results, on effectiveness of interventions, and economic use of resources that are allocated to development, and in this case to the fight against malaria. Using this mechanism in partnership with RBM partners, including the UN Special Envoy, we have seen, for example, African heads of state and government remove taxes and tariffs on anti-malarials. We have seen a tremendous progress on the African continent in the banning of monotherapies. In fact, there are only 2 countries that lag behind, as opposed to when we started, when ALMA was first created, when we had over 20 countries that were lagging behind. We have seen the heads of state partner with the ministers of health to work with influential partners at country level in order to engage in task shifting in health. Those of you who have worked in the health sector will appreciate that task shifting is a very, very delicate matter that has to be carefully negotiated between the health professionals, the Ministry of Health, and of course, policymakers in the country. And we have seen tremendous progress in task shifting in order to accelerate community case management, which enables the delivery of malaria interventions at community level by community health workers in order to ensure that whenever a child indicates with a fever, they are rapidly tested for malaria and given ACTs of antimalarials on the spot at community level without the delay that normally results in children having cerebral malaria and ultimately dying. The focus of the heads of state on this have actually enabled the RBM community to advance their targets. Previously, the impact target was a 50% reduction in the incidence of malaria. It is now 75% because we have been able to see that there can be a lot of progress with policy level commitment and the drive and acceleration that the heads of state has brought to the table. We now have 13 countries on the African continent who have either achieved 75% reduction in incidence or are on track to achieving 75% reduction in incidence. And with careful monitoring over the next 2 years, we are confident that we will see a much bigger number achieving this. The African Leaders Malaria Alliance has also been able to use the authority and the commitment of the heads of state to accelerate innovation in the fight against malaria. We piloted a bulk purchasing mechanism, working together with financing institutions like the World Bank. We like working with innovations like the pledge guarantee mechanism that has been piloted by the UN Foundation. And with these mechanisms, we're able to accelerate procurement and delivery of malaria commodities in up to 8 countries in Africa, from delays of 9 to 12 months down to 3 months, and in one case, even 6 weeks between the time when a tender is put out and delivery of antimalarials occurs in countries. And we are very, very happy that the Global Fund has actually committed to also learning from this example and establishing a bulk purchasing mechanism that will be similar to the one that ALMA was able to pilot in partnership with the World Bank and UNICEF and the countries. We are fully committed to the fight against malaria. The founding chair of ALMA was His Excellency President Jakaya Mrisho Kikwete of the United Republic of Tanzania. The current chair is President Ellen Johnson Sirleaf of Liberia, and the incoming chair will be President Gwebuza. So you can see that the heads of state are so committed that they don't want there to be a gap. All the time they know who is going to be the next chair. They are preparing themselves, and we are delighted to be partnering with the UN Special Envoy, particularly now that has been given the responsibility for financing, because financing continues to be a great challenge for the African continent, and sustainable financing of this fight. But the heads of state have been so committed to this that a considerable number of countries, even during these times where the financial economic markets are particularly stressed, have seen an increase in resource allocations to health in order to support the fight against malaria, the fight against HIV/AIDS, and global health on the continent. Thank you.
Thank you very much. Well, we also have a video message from the Minister of Health of Mozambique, so we'll try to fire that up right now, I think. Okay, let's see.
World Malaria Day marks a moment of global solidarity, an occasion when we in Africa join with all our partners to reflect on some remarkable advances, on to move confidently towards ongoing challenges. This World Malaria Day, we have fewer than 1,000 days until 31st December 2015, the United Nations deadline to achieve near zero malaria deaths and other health Millennium Development Goals. To fulfill these ambitions, humanitarian aim, we must save the lives of 4.5 million children. With malaria such a significant contributor to these losses, our work takes on even greater urgency. We will channel this urgency into action. We, as individual nations and as a whole, can point to promising results, from long-lasting insecticidal nets to artemisinin-based combination therapies to indoor residual spraying. The availability and utilization of life-saving commodities have increased dramatically in recent years. Consequently, malaria mortality rates in Africa have declined by more than 1/3 over a decade. Our progress, of course, is fragile, but our commitment has never been more resolute. We focus intently on those priorities essential to securing the health and the well-being of our citizens. With needs often not matching resources, we must support those bodies that have fueled many of our gains, such as the Global Fund of Fight Against AIDS, Tuberculosis, and Malaria. Their continued vitality strengthens all of us. At the same time, our governments and the private sector will position us to participate more fully in financing a future without malaria. Millions who otherwise might not have survived to reach this World Malaria Day celebrating with us, they are our greatest accomplishment. Only when all of those once at risk share every 25 April with us will truly have succeeded.
Okay, that's what we have.